Welcome back, everybody, to Wealth Dynasty. We're glad to have you guys back. And today on our show, we're going to have a really timely and important episode with Fernando Leopold. He is the CEO of Family Care Insurance, and we're going to talk about some changes with the healthcare for 2026 plans. We're going to talk about, what you really need to know, 5 things that you need to know before choosing a plan and before starting your 2026 healthcare plan. So without further ado, why don't you introduce yourself, Fernando? How long have you been doing this, and tell us a little bit about yourself.
Hi, everyone. Hi, Mark. Thank you for having me. Well, like Mark said, I'm an insurance agent. I've been in the marketplace plans for ever since it started. It's going to be 12 years already that I'm licensed to do health insurance. I've been helping people this whole time. Literally, it's been thousands of people that I've been able to help throughout this time. And it's been really nice. It's been really good. It's been very rewarding to help out people and being able to serve the community.
Awesome. That's good. So tell me, what are some of the things? I guess we'll start out with, the tips that we wanted to talk about today. We got some tips. Let's just start with number one. What's tip number one for this year's open enrollment? We talked a little bit about before the call about the dates and timeline. So what do people need to know about the dates this year?
Yeah, so this year it's going to be very different than all of the other years. As we all know, the political situation always focus on this type of insurance. They've had their eye on it for a while. So now this year is going to be crucial, and a lot of things are going to be changing. Like, for instance, before they used to stand the capability of being able to get inside the marketplace, a marketplace plan. But this year is going to be set from November 1st to December 15th to be able to start in January 1st. So that is
Okay.
something that they're going to be very strict about, and that they've been trying to enforce for a while. And now this year, along with a lot of other things, there's going to be a lot of changes coming for 2026.
So if somebody wants coverage starting on January 1st, when do they have to have their plan and everything set in place?
So they have to have it before December 15th. But I would encourage, and I would let people know that not to wait to the last minute, because many years you never know what's going to happen throughout the open enrollment. We had one year where people were waiting for some reason towards the end of the open enrollment to be able to enroll, and this company closed their doors and they weren't be able to accept any more enrollees in their plan. So that was a couple of years ago. It happened with Oscar Insurance. For those that are familiarized with the different plans,
Mm.
they had to close their enrollment like around December 2nd or 3rd. I don't remember exactly the date, but they had to close it like 2 weeks before December 15th. So I would encourage everyone to start doing it as soon as possible. The doors are going to open on November 1st. The plans are already out now at the time of this recording. Today is October the 30th. So it's already open. The plans are already out there. And I would encourage everybody since November 1st to start enrolling.
That's awesome. Now, I do know on that, in the last couple of years, the website has been crashing on December 15th. It's completely crashing because everybody's trying to get on there like last minute. So do not procrastinate, people. Get on this as soon as possible. You can literally do this starting this Saturday. So do not wait until December 15th. Awesome. The premiums this year are going to be higher than normal. Is that right? And does that mean, I know we've seen on the news, they've been talking about how the government is getting rid of ACA or trying to get rid of the subsidies. Can you clarify that for everybody?
Yeah, so they're not actually trying to get rid of it. What they're trying to do is so there was for COVID, they gave an additional amount of money to be able to lower the premiums for a lot of people. A lot of people were taking advantage of this for this couple of years. Now in 2025, the period that they extended it ended now. So it's not right there in place now. What they're trying to fight is for this extended help to be added permanently into the ACA As of now, the government still shut down because of that reason. But even without that, the plans are still very affordable. I've been quoting some people today, yesterday, and their plans are no more than $30 a month. That is gonna cover like a lot of, so people that were paying zero this year is going up to like $30 a month. So that is still they're paying something, but it's not
Yeah.
something that's gonna break your bank, and the
I
benefits
mean,
that you're getting from it is they're they're really good.
yeah, that's not even that bad, honestly. I mean, I've
Hmm.
seen on the news, it's kind of like I feel like they're almost trying to scare people about this
Yeah,
situation, right?
as news always do, right? They're trying to make everything bigger than what it is. It is important. It is important for a lot of people. Everything is getting more expensive, and now to add another expense into that bucket, sometimes it makes it too heavy to carry for a lot of families. But in reality, when you come to measure what you're getting out of the investment that you're doing in your health and the insurance, I would much rather pay $30 towards this than maybe $30 towards a new phone or something like that, right?
That's a really
So
good point. Yeah, that's a really good point.
yeah, and everything, the reality of things that everything is going up in price, and health insurance doesn't get away from this. It's something that we have to expect that as everything it grows and it gets more expensive, but to take into consideration all the benefits that this brings you, it's not really that bad. And there's always different options. Now, I'm telling you $30 on the plans that give you the most coverage, but there's
Like
people
a
that
silver
really,
plan.
right, the silver plans. And there's people that maybe they don't go to the doctor as much and they still options on the gold plan, which tend to be a little bit cheaper, and also the bronze plans. Now, you guys have to take into consideration that when I say that the prices are going up, and it's in a certain income bracket, right? Everything is gonna depend on where you're gonna be positioned on that income bracket. Is your If your income is gonna be higher, you're gonna qualify for less subsidy than somebody that makes a little bit less. Also, the amount of family members, your age. There's a lot of things that go into play when it comes to the value of how much you're gonna pay monthly of your plan. But I'm talking like in general, and in a general perspective, the amount of increase, it hasn't been really that bad.
Yeah, I mean that's not even that bad. I mean, honestly, for some families, this is gonna be it's gonna be tough. It's gonna be tough for some families.
Yeah.
But this is a lot less than what the news was kind of making it out to be,
Yeah,
you know.
yeah,
So that's reassuring. And it's also less than you would have to pay for if you did have an emergency and you had to come out of pocket for this, because with insurances, there is a cap on how much, your total amount for the year. And just to give you a quick example, I had a client that he didn't have coverage, had to go to the emergency room because his stomach hurt. And they had to do an emergency surgery to take out his gallbladder. He was in there for 3 days after the surgery, and they sent him a bill for $100,000.
yeah,
So, I mean, $30 a month to not have to pay something like that's like
yeah.
that's
And,
not
and I
even
always
bad.
tell my clients, if you look around, they're the biggest hotels in the city. Any hospital is gonna be huge and full of luxury. So they're not like that for no reason. They're like that because they're very expensive.
Yeah.
Um, I've had numerous customers that they have sent me bills, and the prices are outrageous. I mean, it's very, very. It's like the Wild West when it comes for them to build things. There's no law. They just build whatever they want, whatever they feel like. They bring prices up, they bring them down. They were trying to make them be more transparent into having to post their prices before you decided to go somewhere, but it never came to effect. You never saw
Mm, that'd
the
be nice. Yeah,
the
like
light
a
of day. Yeah,
menu
yeah.
before you decide to make a purchase. Now, you did mention, and this goes in directly to our next point about income and subsidy levels. Let's talk about that next point. Why is income and talking to your agent when about your income levels this year more important than ever?
So, as I mentioned before, a lot of things are getting stricter, and they're gonna be implemented now. Maybe some of these things already existed before, but they're going to be implemented now at a stronger level. If your income is higher when you do your taxes than what you put in your application previously, because remember, when you fill out the application, you're trying to estimate and you're trying to kind of like guess how much you're going to make in the year. Not everybody knows exactly how much you're gonna make. Maybe you can change jobs. Maybe you can get a raise. Maybe they can reduce the hours. You never know which way it's gonna turn. So it's very difficult to know an exact number of how much you're gonna make. They always tell you, to the best of your knowledge, make an estimation of how much you're gonna make. But it's very difficult to nail it in the head, right? So there's no problems when it's close to what you put in your application, but now when you start having differences of like $10,000, $20,000, $30,000, it really hurts you at the moment of doing your taxes.
Yeah,
So
you have to return some of those subsidies, right?
you're gonna have to return them. And before, you had to return like a percentage of those extra subsidies that you would have gotten if you didn't estimate your income properly. Now you're gonna have to return 100% of whatever they gave you extra.
Wow.
It's not
See, that's
100% of everything. It's 100% of what they gave you extra. Let me explain that a little, because sometimes it gets
yeah,
a
yeah.
little confusing. So
That
let's
is, yeah.
say a person that in the application put, just to make the numbers round, let's say they put $20,000 as income,
Mhm.
correct? And with $20,000, they qualify for $100 of subsidy. If they go and do their taxes and instead of 20,000, they made 30,000, they didn't qualify for $100 of subsidy anymore. Maybe they qualified for 50. So now those 50 extra dollars, they're going to charge them to you at the moment of doing your taxes times all of the months that you had it. So if you had it for
Mm,
12 months, now you're talking about
yeah,
um,
$600.
$600. Correct.
Yeah.
And they're going
And
to add
when
that
you're
to,
expecting that, yeah, when you're expecting that money back in your with your taxes, that's gonna be a surprise when they say you got a bill over here, you know.
exactly,
And I
exactly. So
and
it,
yeah,
it is very important not only to have a good agent to your side, you need to have an agent that's going to be on top of those changes, and that is very important, because sometimes we forget, we're on the day to day, and health insurance income from November is not in the top of our minds. But if you have a good agent on your side, those are going to be things that they're going to be reminding you
they're gonna
throughout
be
the
following
year.
up. Yeah.
Yeah.
If you have like a side hustle or some other, you get a part-time job, this is stuff that you got to be really on
Yes.
top of this year more than ever.
Yeah.
So, really good point there. Thanks for clarifying that. That's good stuff. So, as far as taxes are concerned, if you have not declared your taxes in the last few years, is that causing any errors for people that are trying to get the insurance set up, or what's going on with that?
Yes, so that is another point that is happening now. As technology grows, now the communication between marketplace and IRS and the other departments like Medicare, Medicaid, now the communication between them have been getting better and better. So, for instance, now they're gonna start implement. They already started implementing this year. Everyone that didn't file their taxes for 2022 and 2023, they were not granted subsidy for this year. So when the tax season was over this year, if they didn't if they didn't file 2022 and 2023, they took the subsidy away. So I had a lot of clients that they hadn't done it for whatever reason,
Yeah.
and they just
Had
took the
to,
subsidy away without letting them know. One day they went to do their payment, and it went up substantially, because now they didn't have a subsidy with them at the premium. So it's very important that if you're behind in your taxes, to talk to your tax person. Mark and I, we also specialize in tax
yeah, we do
preparation.
taxes. Yep.
So if you haven't done it, it's something that if you want to have a marketplace insurance, you're going to have to do them. They're not giving a choice now to people.
Perfect. That's good. Really good information because you don't want to be surprised by a big old bill.
Yeah, I had one of our clients, they were going to have surgery, and from one moment to the other, they took the subsidy and they couldn't they couldn't do the surgery because he couldn't pay the monthly the premium, you know.
Wow, that's
So
tough. Yeah, that's really
yeah,
tough,
so
especially if it's
you,
something like.
usually when you procrastinate things or you forget to do some things, they hit you at the worst moment possible.
Hmm.
So
Yep. Yep.
it's very important.
Now, some people just have been on auto renewal. Once you sign up for insurance, it usually auto renews it for 5 years, if I'm not mistaken. And tell me a little bit about why you should not just let it ride on auto, and what's your thoughts on that? And can people this year, like in other years, can they change from month to month their plans? Is that still going to be the same, or is there what changes do we have there?
Yeah, so this is something that they used to happen before, but because of COVID, a lot of things they got more lenient. But now everything that they approved for COVID now it's getting to an end now. For instance, being able to change plans or enroll during the year, they're doing away with that also. You're not going to be able to change plans if you're in the middle of the year. So it's very important not to let auto renew your plan. The reason why you don't let your plan auto renew is because now you're writing on a plan from a year ago or 2 years ago, however long you've been without going over your application. So you have information that is not updated and you're running on a plan that it's outdated. So they might be better plans. As a matter of fact, there are better plans. If you didn't renew yourself last year, there's definitely better plans now. Also, the benefits are different. They usually put better benefits. Remember, all the companies are trying to compete against themselves. So, and they have all to turn in their plans for the next year at the same time to avoid
Mm,
one having advantage
yeah,
over the other.
yeah. Look at that other plan and see what we're gonna do better.
Yeah. So,
Yeah.
oh, let's give $2 more, you know?
Uh-huh.
And so to avoid that, everybody, all of the insurances have to turn in their plans for the next year at the same time. So whenever a company does better than the other one, then the other one wants to outdo them in the following year. So it's a healthy competition that happens between the products, the insurances that benefit us at the end as consumers, right?
Yeah.
So if one is offering something else and the other one, it's a good idea to know what else is out there. Even if you want to keep the same, let's say you want to keep the same plan, but now at least you know what is out there, you know?
Yeah, because the drug formularies sometimes change. Your doctor may be accepting different
Exactly.
insurances. Like there's a lot of factors there.
There's new doctors that get out of the plan and don't participate anymore. Now there's drugs that are not getting it covered maybe next year. You know that there's a lot of changes that could happen. And before before this year, maybe during the year you will be able to change. If you went to the doctor and realized that they don't take it anymore, you will be able to
Yeah.
change to a different insurance. That is not going to be the case for 2026. It's not the
Very
case
interesting.
right now.
Yeah. Yeah.
It changed, I think, in August or September.
Hmm.
So right now you can change without a special reason, right? And
Yep.
and those special reasons is called special enrollment period. So the only way to be able to change throughout the year is if you change your status, if you're became a resident or a citizen, you gain any type of status, you'll be able to
Hmm.
change. If
Yeah.
you move
Qualifying events.
from
Yeah.
right, life-changing events. If you have a birth in the family, if you adopted, if somebody passed, if you lost insurance through your job, you're gonna be able to get it, or maybe the kids lost Medicaid. You know, there's gonna be certain events that you're gonna be able to be able to enroll or change plans, but they're gonna be very limited, and they're all gonna require proof. There's not just I moved. No, they're gonna require proof of residence on both ends, you know.
Awesome. That's a really, really important point because before we could just, well, during the last few years with the COVID, they've been very lenient. I've had clients that have gone from, they need to get a surgery, so I need to change plans because my doctor doesn't accept this. So it's been really, really, lenient, but that's coming to an end, it looks like.
Yeah,
So
and the more that it adds to the point that you shouldn't let your plan auto renew, right?
very good.
Not only for those reasons of the benefits, also because of the prices. They might be better prices. They might be better products, new products, different companies. You know.
So speaking of that, we do have some companies that are actually leaving the market from what we've seen. Like, can you talk a little bit to that? Some
Yeah, yeah,
changes in the
absolutely.
market.
So it's not a new occurrence. This happens quite often. Some companies they start in the marketplace, they do very well a couple of years, and then they decide not to participate anymore. But every time that there's one going out, there's probably one or two coming in. So it's a way of them recycling, I guess, some of the carriers that are out there. So next year. Aetna CVS, which is the Aetna product for the marketplace, is not going to be available nationwide anymore. For those that remember, a couple of years ago, we had a very good company called Bright Healthcare that also ceased to participate in the marketplace. Friday, Humana was at one point in some states
Yeah,
and
Humana. Yep.
also left. So there's been a couple throughout the history. Those are just some that pop to mind. And also, there's some companies that don't participate at all. And there's some companies that what they do is instead of getting out of the marketplace, they raise their prices like a lot, by a lot.
Yeah.
Um, Last year, I had people that maybe were in Cigna Connect, and they were paying a certain amount, and then it went up like big time.
Yeah.
I'm talking about changes from like $5 to 350.
Yeah.
So there's a lot of changes that happen usually in the marketplace. That's why it's so important. It's so important that every year, and I don't say this enough, that every year we go over the application and make sure that we're getting the best plan possible
That's
because
really
there's
great.
many changes happening all the time.
Awesome. Great point there. So definitely get with your agent. If you do not have an agent, you have a couple of agents here you can reach out to. Fernando's got a huge business and, lots of agents that he works with that work at their agency. They can take good care of you guys. And we're here to serve you guys. It's all about having the education and making a correct decision that's going to benefit you and your family and your health and your future. So really good stuff there. Anything else you want to talk about before we wrap it up, or any more tips or things that people need to know about this year, Fernando?
So this year, as we know, the plans went up in price, but they're still pending on the resolution that's going to happen in Congress, right? So if it does go through, they're gonna stay at a higher price than this year. It's not like a huge raise in price. It is in some areas and in some insurances, but there's also options. That's what I tell people all the time. There's always options. Don't get married with a certain doctor or a certain insurance. This is something that you're always gonna have to look out for yourself. Don't look out for the insurance carrier. Don't look out for your doctor. Don't look out for hospitals. You need to get whatever's going to be the best for you. This is something that I always tell people. I had a case of a gentleman that liked a certain insurance, and it went from $10 a month to $360. But he wanted to keep that insurance because his doctor took that insurance, right?
Hmm.
And he didn't want to change doctors. So he kept the insurance and paying $360 a month. Coming March of that year, the doctor stopped taking that insurance.
Wow.
So now he got stuck the entire year paying $360 with an insurance that didn't give him extra benefits for those $360 and without being able to see his doctor. So that doctor didn't think about it twice when the insurance didn't become convenient for him, and dropped the insurance and dropped probably hundreds of people or tens of people.
Yeah,
I
thousands
don't
of people maybe. I mean, some of those guys have 1,000 patients.
exactly.
So,
So what I want to tell people is that you have to look out for your own finances. You have to look out for your own health. Nobody's going to look out for you. You have to look out for whatever's going to be the best. And to have a good agent on your side, like Mark, like all of us that work in our company. We can help you out to make the best decision and to choose the best plan that's going to accommodate to you.
Awesome. Good stuff. That's a really good point there. So it's 2 days away. So we're
2 days
yeah,
away.
November 1st. We're gonna rip. The phones will be available from early to late. We're gonna be working pretty much Sunday through Sunday. Most agencies work that way. I don't work on Sundays generally, but most everybody else does. So yeah, you guys go ahead and give us a call if you have questions. If you know any other information, you just want some more information. Our information and socials will be in the bio. And thank you, Fernando, for your time today. Great episode, great conversation about the things that you need to know before making your decision this year on the plans for 2026.
Absolutely. And remember that a lot of different states have different laws as well. So we are contracted or licensed in most states. So if you have a family member, if you have a relative, a friend that lives in a different state, we can also help them out. And we have the methods to do it with different states, because a lot of states have different methods of doing it, but we're able to do in most states.
Awesome. That's a really good piece of information too. So really good. Thanks, Fernando. Thanks everybody for tuning in today. Again, if you have any questions, reach out, and we'll be here next week. So take care.
Thank you, guys. Thank you for having me, and very nice being here.